Hi everyone, this announcement is about PCA pump safety and what nursing students need to know before caring for a patient with a PCA pump. PCA stands for patient-controlled anesthesia. It allows a patient to self-administer a prescribed opioid pain medication through a programmed pump. The key word is patient-controlled. The patient presses a button when they need a dose, and the pump is programmed with safety limits such as dose amount, lockout interval, and sometimes a continuous rate. PCA can be helpful because it gives patients faster access to pain relief while avoiding repeated PRN requests. But PCAs are still high risk because they involve opioids, sedation, potential respiratory depression. Safe PCA use depends on choosing right patient, monitoring closely, and educating the patient and family.
Not every patient is appropriate for PCA. A patient using PCA needs to be alert enough to understand how the pump works, physically able to press the button, and able to use the call aid appropriately. Patients receiving comfort care or end of life may have different ordered settings, so nurses still need to follow the provider order and facility policy. The golden safety rule is simple. Only the patient should press the PCA button. Family members, visitors, and staff should not press it for them. This is sometimes called PCA by proxy, and it can be dangerous because someone else may give doses when the patient is already too sedated. Patient and family education matters here. Nurses should clearly explain that if the patient is asleep or too drowsy to press the button, they probably do not need another opioid dose at that moment.
Nursing assessment is what keeps PCA safe. Nurses should always assess pain level, sedation level, respiratory rate, oxygen saturation, end-tidal CO2 when required, and any overall change in condition. An example of a sedation scale that nurses can use is a POSS. It helps nurses identify opioid-related sedation before it becomes respiratory depression. A patient who is awake and alert or slightly drowsy may be appropriate to continue monitoring. But a patient who is frequently drowsy, drifting off during conversation, or difficult to arouse needs immediate attention. A reassessment should always happen at PCA initiation within 30 minutes of initiation, every 2 hours for the first 8 hours, then every 4 hours while PCA is running. Reassessment is also needed within 30 minutes after dose or setting changes, and as needed for deterioration or any concerning events.
This PCA involves high alert medication. Independent double checks are required. Nurses should double check when the PCA started with each new medication syringe, with infusion rate changes, and with concentration changes. During RN handoff, nurses should verify pump programming and trace the tubing from the source all the way to the patient. Reportable red flags include a respiratory rate less than 8, oxygen saturation less than 92% despite oxygen, POSS greater than 3, an unresponsive or deeply sedated patient, increasing oxygen needs, or any change in level of consciousness. The key takeaway from our PSA is that patient-controlled analgesia still requires nurse-controlled safety. PCA safety comes down to the right patient, the right assessment, and the right safety checks. When nurses monitor sedation, respirations, pump settings, and patient education carefully, PCA can support pain control while reducing preventable harm.